When an Indiana pharmacist died unexpectedly after having a heart attack at work, her story became part of a national cry for change in the pharmacy industry. 13 Investigates reporter Sierra Putman joins us in studio, and her dad reached out because he was pushing for change here in Indiana.
Yes, he wants lawmakers to listen to pharmacy workers who are warning that current working conditions are putting their lives and the lives of patients at risk.
Traffic is a lot different than it used to be.
On a sunny day, Larry Anderson took us to visit his daughter, Ashleigh.
And we're here. But this is Ashleigh.
A final resting place adorned with what she loved. At the heart, the symbol of her profession. Ashleigh was an award-winning pharmacist with a strong work ethic.
And I admired that about her. But now I think that was part of her demise.
In 2021, Ashleigh was working at the CVS in Seymour when she texted her boyfriend she had jaw pain, intermittent chest pain, and cold sweats. She wrote, "I think I'm having a heart attack." But Ashleigh was the only pharmacist at the store, meaning if she left, the pharmacy would close.
She felt that if she went to the hospital, closed the pharmacy, and it was a panic attack or something other than a heart attack, that she would be judged and treated adversely.
So the 41-year-old waited for a replacement. Ashleigh collapsed before another pharmacist could arrive. She later died. In a statement, CVS told 13 Investigates it remains deeply saddened by her death, but noted Ashleigh was explicitly told to close the pharmacy and seek medical attention. After her death, pharmacists across the nation rallied around the hashtag #SheWaited.
CVS did not kill my daughter, but the changes that occurred at CVS and throughout the pharmacy industry, that killed my daughter.
Changes like more work and fewer workers. In last year's Mayo Clinic survey of medical workers, pharmacy professionals reported burnout more than any other group. Nearly 30% of those working at chain pharmacies said they were in distress, which could lead to more mistakes that impact patients.
The whole system needs to work together to rectify this.
Veronica Vernon is the vice chair of pharmacy practice at Butler University.
We're noticing there's a significant staffing issues in community pharmacy that need to be addressed.
That includes pharmacists and support staff. In a 2022 national workforce study, more than 70% of respondents thought staffing levels and almost 90% thought workload metrics reduced or significantly reduced patient safety. A separate study estimated there are 7,000 to 9,000 deaths in the U.S. each year due to medication errors across the healthcare system.
The public is at risk.
Research shows overworked pharmacy staff make more mistakes, impacting patients like 4-year-old John Castellaro. He's fine now, but this winter,
we've overdosed him.
His parents say they discovered his medication was too concentrated.
I think it's a CVS issue, not this particular pharmacist. We've routinely heard from them that they're understaffed.
13 Investigates spoke with 4 Indiana pharmacy workers that spoke anonymously to detail their experiences. One pharmacist said they left retail pharmacy because it was becoming unbearable and unsafe. Others said work requirements were practically impossible, dangerous for patients, and described going to work as war.
But Ashleigh was a lot more than a story.
Which is why Anderson is working for change. He's talking to the Indiana Pharmacy Board, the Pharmacy Association, and state lawmakers, pushing them to look at what other states have done to tackle this issue.
AB 1286 is a patient safety bill.
Last year, California became the first state to require the reporting of all medication errors. The new law also set minimal staffing requirements.
Ayes 43, noes 8.
In Ohio, the Board of Pharmacy passed several new rules. They set minimum staffing standards, require rest breaks, allow pharmacists to request more staff, and provide whistleblower protections. Protections Anderson wishes his daughter had.
What are you hoping her legacy is going to be?
My hope is that change,
including new laws or rules for the profession, and stiffer penalties for violations.
Sierra, how likely is it that this dad will be successful in changing the rules?
Well, when we're talking about state leaders, you never know what they're going to do. But when I reached out to some lawmakers, many of whom Anderson contacted, they told me they're open to learning more. Indiana's Pharmacy Association says it's reviewing his proposals. So we'll see what happens during the next legislative session and what may or may not happen at the Pharmacy Board meeting.
All right, Sierra Putman with 13 Investigates. Thanks.